Hello and welcome to Dignity Health Social TV. Today we're talking to orthopedic surgeon Dr. Dotson. Dr. Dotson, thanks for hanging with us.
Thanks again.
So what is it that you do?
You know, I'm an orthopedic surgeon that specializes in sports medicine, sports medicine director at St. Elizabeth Hospital. So we see a multitude of problems, whether or not we're treating the youth athlete or the weekend warrior. So when we think about sports medicine, oftentimes we think about sports, but really it's really talking about helping people who are active.
Yeah. And so you see a lot of shoulder injuries, I'm sure, in your field. What are some of the bigger, more common causes of shoulder injuries or shoulder problems?
That's a great question. Actually, with shoulder pain, it's really hard to think about shoulder pain without considering the anatomy. One, the shoulder is a ball and socket joint where it's one of the most mobile joints, and as a result, it sustains multiple injuries. You have your articular surface that kind of provides smooth motion. You have the ligaments that give it stability, and you also have the muscles that allow movement. As a result of that, most shoulder injuries tend to be soft tissue. On one hand, if you have someone with a chronic problem where they may have arthritic type pain versus someone who might have an acute injury, or someone who has a repetitive issue, whether or not it's someone's torn a rotator cuff, which is one of the muscles that attaches to the arm, or someone who's a pitcher who may have shoulder instability where the shoulder is coming in and out of place.
What might be some symptoms, whether we're very active or a professional or a weekend warrior, what might be some symptoms that may cause me to think, this is a little bigger deal, I should probably go see a physician?
Absolutely. Actually sometimes we'll see people who might have a shoulder issue might cause them pain intermittently. But if you have a problem that, one, if it's severe pain, the chronicity, meaning how long the pain is, that you may seek pain. So pain, weakness, stiffness, if you notice a deformity, or seem to be the most common things.
Is there anything that we could do to prevent shoulder injuries?
Absolutely. Oftentimes it tends to be more of a repetitive issue. So one, being considerate of what's going on in terms of your motion, identifying what is the particular problem that's causing the symptoms, whether or not it's overuse, overhead activities, if you have an injury where it's long lasting, and not responding to certain causes.
Awesome. Thank you. Thank you so much for hanging with us. Appreciate it.
Thank you.
Thank you for watching Dignity Health Social TV. For more information, you can visit mercy.org.